Hi everyone, welcome to today's Instagram Live about masks. Thank you for joining us. We will be getting started shortly. Thanks for joining today's Instagram Live about masks. We are just getting ready for our expert to join us and then we'll get started. Today's topic is masks, the use of face coverings. Let's see who we have coming in. Looks like, so we'll just wait for her. Hello, can you hear me okay, Amanda?
Yes, can you hear me?
I can hear you perfectly.
Great.
Fantastic. So, first off, let's talk about asking questions and everything behind that. Welcome to everyone. I see there's already 600 people on here. Welcome to our Instagram Live about masks. Obviously, thank you all for joining us. My name is Ed Bottomley with the Michigan Medicine Department of Communication. And today, obviously, the topic is masks. Research shows that wearing a mask can greatly reduce the spread of COVID-19. Per a recent executive order, Michiganders are required to wear a face covering whenever they are in an indoor public space, and it also requires the use of face coverings in crowded outdoor spaces too. Now, lots and lots of people are still going to have questions about mask wearing. For those tuning in live, you can submit these questions at any time, even now. You can comment on this video. There's a very nifty little question asking tool at the bottom, but please note that your name or your profile name will be visible to everybody else participating. And finally, just one more piece of admin. If you can't stay for the whole chat or you want to share this recording with a friend, a video of this chat in its entirety is going to be up on this page later today. So now let's introduce our Michigan medicine expert, Amanda Valyko, MPH, Director of Infection Prevention and Epidemiology for Michigan Medicine. Thank you so much for joining us, Amanda.
Thank you for having me.
This is a really, really important chat I think we're having right now, and almost the perfect timing for it too. Let's go straight into the question. My first question for you: what is your collective opinion on the value of wearing masks outside and inside?
Sure. So I definitely think that wearing a mask is one of our key interventions, along with social distancing and hand washing, to prevent the spread of COVID-19. So number one, it protects others. If you happen to have gotten infected with COVID and you're not feeling sick yet, or you don't happen to get symptoms, this can really prevent you from spreading your germs to other people. So that really reduces the risk to others. And then it does give you some level of protection as well. I can't quantify it. There's not a lot of data, but covering your nose and your mouth helps to prevent respiratory droplets from falling into those places, and that's how you can become infected. So it definitely offers some level of protection to you as well. So I think it's sort of part of that three bundle items of social distancing, hand washing, and of course masking.
That's fantastic, and I'm glad you mentioned the nose aspect, nose and mouth, right? I have 3 sample masks here, which I'm going to ask you probably at the end, so we don't have me with masks around my neck. But often I do see people with the mask slipping down, the nose out. That's not what we want, right?
Correct. To be effective, the mask has to cover your mouth and your nose, and in a snug fashion, not very tight that it prevents you from breathing, but in a snug fashion to cover your nose and mouth is the proper way to wear a mask.
Perfect. Thank you for that. When are masks required? This is a big question.
Yep. So basically, if you are leaving your house and going to a public building, so going to be indoors in a public building, a mask is required. And if you're going to be outdoors but not able to reliably maintain 6 feet of distance from others, a mask is required. And also if you're waiting for or riding in public transportation, and that would include sort of ride sharing and Ubers and things like that, a mask is required.
Now, my next question for you: does a mask protect the wearer or just everyone else? You touched on this a bit earlier, but I think it bears repeating.
Sure. So I think both. Definitely there's good data that shows that mask contains your germs, so protects others, and we call it source control. So there was a recent study that actually showed that unmasked droplets were going about 8 feet. Wearing a mask kept the droplets to less than 1 foot. So the person wasn't able to spread their respiratory droplets more than about 1 foot. It did actually show that there are better masks and worse masks. So actual masks did perform better, and things like the bandanas and the gaiters did perform not as well. So those folks wearing those were able to cough their droplets out further, and those wearing actual masks contain them to about 1 foot. So that's the side that protects others. So for protecting you, which I touched on before, there's not a lot of data out there on that side. However, as I said before, one of the main ways to get infected is having these droplets land in your nose and mouth. So this does provide a barrier there, which is some level of protection. It's not zero. And then the other thing that we sometimes see is that a mask can just be a good reminder not to touch your face and things like that, where you could kind of cross-contaminate yourself. So I think those are 2 ways that a mask does provide some protection to you as well.
Thank you for that. My next question about N95 masks, and I think I know the answer to this. The question is, should we all be wearing N95 masks if we can get them?
So I would say no. I don't recommend it. I don't know how many people have worn N95 masks, but they're really difficult to breathe in. So those ones are difficult to breathe in because they do have a very tight fit, and they do filter out a large portion. So to be effective also, though, a good fit is needed. So in healthcare, we wear these for certain types of patients and types of procedures, and you are fit tested for them. So you actually have a medical fit test where we make sure it's safe for you to wear. You don't have a medical condition where this could be problematic for you. And also that it actually fits your face properly, so we know that we have a good seal. So if you don't have that, it might give you a false sense of security as well. And then really with COVID-19, the available data really points to the main mode of transmission being sort of that close contact droplet spread. In healthcare, we do procedures that might cause aerosols to be generated from people, like putting in a breathing tube or something like that. And we're doing things like that. That's when you might need something like an N95 mask to provide protection. But for our regular contact, a medical mask or a face mask or a cloth mask, those things would all be appropriate. So I think that the risks outweigh the benefits for everybody wearing an N95 mask.
Yeah, thank you. I think that's a really important explanation there. I'm looking down at my masks. I wonder if we might just move on to those right now. So sure. N95, I don't have one with me.
I have one. Would you like to see it?
Oh, I'd love to see one. I'd love to see one.
This is the N95 mask, and you probably can't see it in here, but they have like a little NIOSH stamp so that they're approved by NIOSH, which is the regulatory agency. So this is an N95 mask. It fits tightly. It has 2 straps on it, one that goes sort of at the top of your head and one underneath, and it fits very close to your face. So,
as you mentioned earlier, these are fit tested when medical professionals wear them. So I think it was fantastic when you said it could give you a little bit of a false sense of security if, you know, say this guy here is just swanning around with an N95 mask and I don't really have it fit properly. Mm-hmm. And you said the correct fit is pretty uncomfortable too, right?
It can be, especially when you wear it for a long time. I think many healthcare workers could attest to that. The nose piece fits very tightly, and they are much more difficult to breathe in. So a regular mask is uncomfortable, but you can still breathe pretty easily in it. And an N95 mask, after a long period of time, you'll definitely be sweating a lot, and sometimes people will get ulcers on their noses from the nose piece fitting so tightly. So they can become uncomfortable.
My gosh, that's very interesting. So we'll move into my collection of 3. This one I do not wear, but this is a bandana. Now, you mentioned earlier, could you reiterate what you said about bandanas? They're not quite as good.
They're not quite as good. They're still better than nothing. But the study I mentioned found that with bandanas, your droplets could be coughed out further than with an actual mask. So the mask kept it to about 1 foot, and the bandana was a little bit more than that. I think more like 3 feet.
That's interesting. That's very interesting. The one that I use the most, really just a typical mask. It's got a little bit of a nose clip here. Mm-hmm. It fits over my face and over my ears. Mm-hmm. And then the third one I have with me, this one looks very similarly to the second one, but it has the ability to put something inside it, maybe an additional filter.
Yep.
So those are the 2 that I use the most. The bandana is not one that I use as much because, as you said, not quite as effective.
Correct. Yeah.
Okay, the next question that we have, are carriers who don't have symptoms really not as contagious?
I think that's a really good question. So I think that part of it comes with when you have symptoms, you are coughing. And when you are coughing, your respiratory droplets travel further. So we have found with COVID-19 that there are people who are asymptomatic that are growing the virus, for example, in their nose. And I don't think there's good data yet to show the exact levels of asymptomatic versus symptomatic. And with most viruses, symptomatic people tend to shed higher levels of the virus. But I think one of the key factors is that when you have symptoms, you're coughing those germs out further. And so you have the ability to sort of spread your germs further and be more of a risk to others. So that's kind of how I usually approach that.
We have so many questions coming in. It's hard to even pick and choose. But let me just pull out a couple using this nifty little graphic that we have. So here we have one question here: are the plastic face shields better than masks?
That is an excellent question, and I've been getting that a lot. So the answer is no. So plastic face shields are made to be used in conjunction with a mask. So wear your mask, and the face shield adds extra protection. So it would certainly keep droplets from coming in contact with your eyes, which is great. And it also, if you have the shield that comes over your mask, helps to prevent the contamination on the outside of your mask. But since the face shield doesn't fit snugly, your germs are still able to sort of get out more easily of there and be a risk to others. And also, if you did encounter nearby respiratory droplets, there's certainly a possibility that they wouldn't be stopped by that, since it's not fitting snugly over your nose and mouth. So I think that the best use for face shields is in conjunction with a mask, and we certainly do that all the time in the healthcare setting.
Thank you so much. The questions are coming in thick and fast, and they're really all over the map. The next one we have, I want to tie it into another question that I saw come in. This question here is, how often should masks be changed? But I also have on my question list, do I have to wash my mask every day? And I think those kind of relate to each other.
Sure. So do you have to wash your mask every day? I think that if you want to follow the letter of the law, that's probably the best practice, but I really think it depends on how much you're wearing it. If you're wearing your mask for the entire day, all day, you're probably going to be sweating some, and you probably do want to wash it every day or two. You just wear it when you're going to the grocery store for a little bit, and then you're leaving it in your car, and then you wear it the next time. I do that with my mask, and I'll usually wash that mask if I've only worn it a couple times for a short period, at least weekly, every few days or weekly. So I think if you're wearing it all day long, you kind of sweat a lot, and I do think it's probably a good idea to wash it in those circumstances, but I think in reality most people don't, and washing it every couple of days, or if you don't use it often, once a week, is reasonable.
Thank you so much. You're really it's great to have you on here with all these questions coming in. The next one we have up from a viewer who says they wear a mask in public indoors but have stopped wearing a mask outdoors. They don't congregate in groups. However, during their outdoor walks, they say they sometimes have runners, walkers, cyclists pass them. Mostly it's at the recommended 6 feet, but sometimes it's closer. Just how risky is it being in the outdoor draft of someone perhaps COVID positive that is breathing heavily? They want to know if they should bring their mask, wear it all the time, perhaps in these outdoor situations.
Sure. So I think that certainly being outside is far less risky. So when you're outside, whatever you're breathing out is pretty quickly diluted by the air and the air movement outside. So it dilutes anything that people would be breathing out pretty quickly. That said, the risk isn't zero. So I definitely think that maintaining that 6 feet of distance if you're not masked outside is important. And I think the best case scenario is doing your walk or exercising somewhere where you can typically achieve that. If people do pass by you and they're exercising, they're breathing heavy, I say try to keep your distance. And when this happens to me, I would turn my head, right? Turn your head, get by, and, keep moving on. So I think it's not as risky as not masking indoors. I think if you're going to be like on a bike path that's pretty crowded or something like that, I would wear the mask. But if it's sort of the one-off things, I think you're risk is pretty low. It's not zero, but it's pretty low, and kind of getting by and turning your head and trying to keep your distance is probably reasonable.
Fantastic. The next question up is regards to kids and babies and face masks. I'm lucky enough. I have a 5-year-old, and he actually wears his pretty well in the couple of situations where we've had to. But this question here says, my child won't wear a face mask. I'm worried about taking them out in public without one. Any suggestions? And we also have another question I'll fold into this. We have a newborn. Should adults wear masks while holding our baby?
Good question. So for the question about should you have folks wear masks while holding your newborn, I would say yes, because when somebody is holding the baby and presumably talking to you, they are expelling droplets that are probably falling on the baby. So I would absolutely recommend that for your outside of your household, having people mask when holding the baby. As far as kids, I can definitely relate. I was lucky enough to get my 2-year-old to wear a mask to a well child visit, which I was surprised about. But I think this is challenging. I think your best bet is only to really go to like a controlled environment. So when you're not masked, I think really maintaining that distance is key. So in controlled environments where you know you can maintain that 6 feet or really more if possible distance, I think that's reasonable. But I probably wouldn't be comfortable going to the store or somewhere where you're passing by lots of people if my child wouldn't wear a mask. I have seen targeted at kids the hats with the large face shields that kind of come down. So we talked about how face shields aren't a substitute for masks before. Those might offer some kind of protection. There isn't any data on those, but it might be something to kind of help to cover their face. Now, that said, probably if the child won't wear a mask, they're probably not going to want to wear a hat with a face shield either. So I think the best bet is kind of those controlled environments where you can maintain distance is probably the safest.
Thank you so much. We have quite a few questions coming in. I know let's go on if we can for maybe 10 more minutes. We'll try and fit in as many as we can. This is one that you've touched on earlier. Worth reiterating for everyone jumping on in the live format. What is the best kind of mask?
So, I mean, honestly, the best kind of mask is the mask you can tolerate and not have to keep adjusting and things like that. I think that's the best thing. As I shared before, I think an actual mask, right? Not a bandana, not a neck gaiter, an actual mask, whether it's cloth, etc. I think that the World Health Organization has some guidance on layers of masks. So if you're so inclined, so 3 layers can be preferable because it has, several layers of protection. So usually the layer by your face is cotton. And then I think you mentioned you had a mask where you can put a filter in. Those filters can just offer a little bit more protection. And then the exterior is usually something like polyester or something that's maybe a little more fluid resistant, if you will. So I think that's the recommendation for the cloth masks that are probably most effective, but really something that covers your nose and your mouth reasonably snug and that you can tolerate and not keep adjusting is what I would recommend.
Fantastic. The next question that we have up, can you reuse a surgical mask?
So reuse a surgical mask. So I think it kind of depends on what we're talking about. So if you have a surgical mask and you're using that as your mask, like to go to the grocery store and things like that, I think it's reasonable to reuse it, not forever because you can't wash those. You definitely can't wash surgical masks. They'll lose their filtration properties once they get wet. But I think that if you're careful about cross-contamination and you can take it on and off and store it in a way that, basically you don't want the front part of it to be contaminated and the back part of it is the goal, that you can reuse it for a limited period of time in sort of the public setting. So I think that would be okay, but, it would be limited.
Yeah, thank you so much again for tackling all these different questions. The next one we have up asks, should I wear a mask with a built-in respirator valve?
Oh, that is an excellent question, and I get that a lot. So I think we're talking about the exhalation valves on many of the masks, which make it much easier to breathe. So the problem with those is that you lose the source control of the mask. So when those masks with the exhalation valve allow you to breathe your germs out still. So it doesn't provide that source control of keeping your germs contained. So we do not recommend those. In fact, if you come to Michigan Medicine for an appointment, with a mask with an exhalation valve, will likely ask you to place a surgical mask over it or switch it out, either one. But those valves allow your germs to come out, so then your mask doesn't provide that source control, which is really one of the main goals of masking.
Perfect. The next question after that, and I know that was a very hot button question. This one asks, I have asthma. If I have asthma or another chronic lung disease, do I need to wear a mask?
So many people with chronic lung diseases are at much higher risk of complications if they get COVID. So I do think that it's prudent to think about sort of the risk there. I definitely think it's important to talk to your doctor about whether you can medically tolerate a mask. Typically, cloth masks or like the surgical masks are well tolerated by many people. Certainly the N95s would be probably a problem in those folks, but talk to your doctor with questions. But I do think that it would be really important to protect yourself by wearing a mask. And if you can't, then I think that distancing and really trying to avoid those social settings would be really important.
Fantastic. The next question we have, and this is one that I've heard bouncing around as well. Someone asked, doesn't wearing a mask cause a dangerous buildup of CO2?
I have also heard that going around. So no, there isn't any science to support this. So for example, healthcare workers have been wearing masks for prolonged periods of time forever. Very long surgeries, and in light of COVID, most of us have been masked all of the time. So it doesn't, the CO2 is a very small molecule that does diffuse in and out of a mask. So it doesn't cause your CO2 levels to become high or dangerous. So I think that's a myth that I have also seen out there, but I don't believe there's any truth to it.
Thank you. Thank you for helping us bust that myth. The next question we have up, do I need a mask if I'm tested regularly and have no symptoms?
So yes, for a couple of reasons. So you would have to be tested, probably every other day because anytime you would go out anywhere, there's a potential for exposure, right? So you'd have to be tested probably every other day, which there isn't the testing supplies to do. And for those who have had a nasopharyngeal swab, they hurt. So it probably isn't something you would want to do. The other thing is there are false negative tests. So, you can't be certain that is an actual negative. And so the recommendation is still to wear a mask. And then there's the piece about protecting yourself. So keeping yourself safe by wearing the mask as well. So.
Absolutely, and they all mesh in very nicely together. Then we have two more questions for you, Amanda. The next one, are masks safe to wear even during exercise that may result in heavy breathing?
Yeah, so I think in most cases the answer is yes. Like I said, the CO2 that you breathe out does diffuse through the mask. I think one of the issues with exercise and masking, it isn't comfortable. It certainly isn't comfortable. So I think that's something to be considered if you can exercise away from people so that you don't have to mask. I think that's preferable. The other thing about exercising in a mask is that you sweat, and when masks get wet, that can make it more difficult to breathe in and things like that. So you may have to change your mask more frequently if you're doing heavy exercise for those cases.
Absolutely, thank you for that. And we have a question up that says, are surgical masks better than a cloth mask, in your opinion?
So typically, yes, they are. Surgical masks have ratings. So medical masks have certain ratings for particle filtration and bacterial filtration and things like that that are standard in healthcare. So they do have studies done on them such that we know how much they filter out and things like that. So they probably are more protective. But it is also really important that we have those in healthcare to care for people. So I think that's important to make sure from sort of a supply chain standpoint that we're allocating masks where they're needed.
Absolutely. Now, before we finish today's Q&A, do you think there's anything that we've missed? Are there any questions you think we've missed?
I think the face shield one was the one I really wanted to bring up. So I was glad that somebody asked that. So I can't think of anything.
Fantastic. Well, thank you so much for answering such a wide range of questions, and very important questions too. Thank you to all the viewers who jumped on. This again, if you were jumped on halfway through, will be available on the University of Michigan Instagram page and other outlets too once we download it. Amanda Valyko, Director of Infection Prevention and Epidemiology at Michigan Medicine, thank you so much for your time.
Thank you very much. Have a good day.
You too. Bye now.
Bye.